we're 4 months into PDPM now, just started PDGM. When we were getting ready for the changes that have hit the industry, uh, go back to some of the key things that we thought we needed to prepare for, and talk about how those played out as you've seen us in the early stages.
Sure. Well, you'll remember how we talked a lot in the preparation stages about how important collaboration was going to be between therapy and the provider staff. And we talked about how, gee, hasn't therapy always worked well together? And we said, sure, we have. But under PDPM, we envisioned that collaboration was going to have to go to a whole nother level. And I think the reason we felt that is because PDPM was and is very complex. A lot more things to consider about patient characteristics and try to capture all of those characteristics about a patient so that the payment can be as accurate as possible. Um, how has that played out? I think it's sort of been a mixed bag. I think with some providers, there's been a strong realization about the value of that collaboration and how important it is to have many individuals, many caregivers, not just therapists, but other caregivers in the facility as well, involved in contributing information so that the items that are recorded on the MDS are as complete and accurate as possible so the payment can be accurate. Another thing that we talked about as we prepared and used the CMS data file from 2017 as background is it became very apparent that there were going to be opportunities for better capturing of patient characteristics. We felt like the coding projections based on that 2017 data left a lot of room for opportunity. And it wasn't because providers weren't paying attention. It simply didn't matter from a payment perspective. And I think we assumed that everyone would get a lot better at coding and capturing patient characteristics on the MDS. That's been somewhat surprising. As we look at certain characteristics, the degree to which we've really done a good job, we collectively have done a good job capturing those, has been, I think it has been a little bit of a shortfall. Specifically, some of the PT and OT, the diagnostic groups, I think to some extent, the GG coding, and specific to GG, I think the continued opportunity is for more collaboration that we talked about just a moment ago. In the speech category, it is surprising. These are our own observations. We also read them in other industry summaries. Surprising at the degree to which, the number of which rather, patients who are reported as having neither a swallowing disorder nor a mechanically altered diet, and yet a percentage of those patients are treated in speech therapy. So that just points at, I think, continued opportunity as well.